Basma is anemic. She's one of over 2 billion people worldwide who suffer from this exhausting condition.
Only complaint, but he's feeling well.
She has no appetite, she's tired, and she can't concentrate. There's not enough iron in her blood to allow it to carry sufficient oxygen to her body and her brain. Without treatment, the disorder will have long-term effects on Basma's health, and she could even die. Iron deficiency anemia is the most widespread nutritional disorder in the world. It's particularly severe in the Middle East, and it affects rich as well as poor. It's often a hidden disease, and young children and women of childbearing age suffer the most. Children can suffer irreversible mental and physical damage. Women with severe anemia can die in childbirth and miscarry their unborn children.
People live with anemia, but they can't work well. People live with anemia, but they can't think well. If you can't live well, and if you can't think well, how you can make your better life? We can't.
Basma is getting specialist treatment from Dr. Ibrahim, a nutritional expert at a clinic in Cairo. Young children are especially vulnerable to iron deficiency. They need a constant supply of iron to grow properly.
Here we are facing many problems of anemia. I find that she is very pale from the conjunctiva of her eye and her pallor of the lip, okay, and also in the nail. Her weight is 18 kilograms, which is not that suitable for her age, which is 5 years and 11 months. And also her height is 109 centimeter, which is not also suitable for her age. This child is not growing well, even physical or mental, and this is will affect her in the school age. When the starting school age next year, okay, she will get some educational problems if she is not well treated now.
Because of complex social and cultural issues, over 50% of the population of some countries in the Middle East suffer from iron deficiency anemia. It stunts the health of entire populations and slows down productivity. The economic consequences of a tired, weak and iron-deficient workforce can run into billions of dollars.
Now, when you translate iron deficiency, this lack of productivity, to actual money terms, you come up with amounts of up to $4 to $8 per capita per year. Now, times 60 million inhabitants, for instance, that's a huge amount of money, and that's really to be taken very seriously.
One of the most effective ways to combat iron deficiency anemia is to add iron to staple foods that everybody eats, a process known as iron fortification. Here, bread is the staple food. Western countries have been fortifying bread and cereals for the last 50 years. But in the Middle East, the idea is still quite new, and the process has thrown up a number of problems. The idea is to add iron to flour so that everybody will get their recommended dose of iron when they eat their daily bread. It was in Egypt, the ancient land of the pharaohs, that legend says bread making was invented many thousands of years ago. Loaves were often buried with the dead to provide them with sustenance on their journey to the afterlife. Ancient hieroglyphics from over 5,000 years ago show that bread was, even then, the staple food. Possessing a great number of loaves meant great wealth. Bread was the currency of the kingdom, used to pay priests and pyramid builders. The pharaoh was the lord of all wheat and flour. In present-day Egypt, bread is in abundance everywhere. Eaten at least 4 times a day, there are said to be over 100 different types of bread here. The most common is baladi bread. In Egypt, bread is known as aish. The word aish means life.
This bread means everything to us. Everything. This bread is the best. That old man over there refuses to eat anything else.
Ramdam Fawzy is one of many thousands of bakers in Egypt. He inherited this bakery from his father, who inherited it from his father. Every day he bakes at least 5,000 loaves.
Of course, I'm proud of what I do. I feed everyone, from politicians to poor people. It's a service that I provide to the whole community when I bake bread, inshallah.
Because bread is so important to Egyptians, any government policy on fortifying bread flour with iron needs careful management. People are anxious at the thought of interfering with something so natural.
We shouldn't put anything into our flour. It will affect the bread. Any small changes will affect our work. We shouldn't play around with things that God gave us. Changing nature will give us a lot of problems.
Dr. Farouk and his colleagues are working with the government and international agencies to encourage the fortification of bread flour with iron. But he knows that he has to take things one step at a time.
Baladi bread, we can say, or the whole bread in Egypt, it is a staple food. Like rice in Far East, but in Egypt it is very precious for, the bread is very precious and sacred since ancient times. And we are keen that the fortification of the bread, the process will be thoroughly studied and done in a very cautious way. So that's why we decided that it has been decided that we have to do a pilot study in one of the governorates, not universal for the whole nation.
As part of the pilot study, Dr. Ibrahim is helping people to understand that the fortification of flour is safe and necessary.
We are planning for social marketing campaign for the flour fortification project, because people must know that we are getting the bread what is must be in the first. You know, the whole flour contains iron, but when we milling it, we exclude a lot of iron. So we return it back, just return it back, okay? And this is in a dose which is safe, in a dose which is not harm, in a dose which is under control.
Dr. Ibrahim takes his work to the eastern region, Al-Fayoum, where a new project to fortify bread flour with iron is scheduled for the near future. Here he works with local nutritional educators like Afaf, who help him talk to people and discuss any concerns they might have. Today they're visiting Saba, who's 8 months pregnant. Because of this, she needs more iron than usual to feed her growing baby.
In our social marketing campaign, it is very good idea that the nutrition educator come to the mother at home. We will use nutrition educators like Afaf. We will teach her, we will teach nurses, we will teach health providers, so that they can visit the home. We cannot visit all homes. You just train them how to educate the people about fortification.
تقطعيها وبتاكليها بطماطميه عشان تبقى نظيفه وكده ويا ريت لو مثلا في عندك الم في القولون ولا الكلام ده.
Home visits aren't just an opportunity to talk about flour fortification. They're also a good way to teach people about the importance of eating iron-rich foods. A few kilometers from Sabah's house is the Al Fayoum flour mill. One of 500 mills in Egypt, it was the first to install a simple flour fortification system. For the last 2 years, they've been adding iron to flour used to bake biscuits for schoolchildren. In a few months' time, they also plan to add iron to bread flour. The iron is added in the form of ferrous sulfate in small doses. The process is carefully monitored at every stage. In this test, the darker color means the flour now contains the recommended dosage of iron.
بنتكلم على رضاعة طبيعية وبنقول الرضاعة الطبيعية مهمة جدا لأن الرضاعة الطبيعية من غير الرضاعة الطبيعية.
Dr. Ibrahim wants to help people like Basma and her mother understand why iron is so important to their diet and how their eating habits can affect their iron intake.
ما يتاكلش ماشي كان بياكل جرجير.
There are many natural sources of iron given to us by God, like spinach, parsley, cabbage, all of them which are rich in iron. The thing is that we need to be careful what we eat with what. We shouldn't drink tea with our meals. And we need to eat our meals fresh.
مرة في الأسبوع مش لازم كتير يا جماعة العملية مش في الكترة. The problem in Egypt is that we make food which is rich in iron, not rich in iron. Some of the problem of iron is the absorption. Iron is an element which have to be in a suitable circumstances to be absorbed. We must have some vitamin C or fruits or vegetable which is containing vitamin C to absorb iron well. Here in Egypt we are taking tea with lunch, not after lunch, no, with lunch. We're taking it with lunch. So the iron content of the food is not well absorbed. So I take iron, but I can't absorb it.
Basma is lucky. As well as eating an iron-rich diet, she's receiving iron supplements.
You can take one. Okay, not more than one.
Her prognosis is good. With luck, she won't suffer any long-term damage.
Oh, very good.
Across the Red Sea to the southeast, Yemen is also launching a national flour fortification program in the near future. In some areas of the country, up to 80% of the population suffers from iron deficiency anemia. Yemen, a country the size of France, but with a population of just 18 million. Yemen has only recently emerged from centuries of isolation and the ravages of civil war. As in Egypt, bread is Yemen's staple food. But here the challenges are different. Fortifying flour is just one part of a need to address basic health issues, compounded by extreme poverty, primitive infrastructures, and inaccessible mountain ranges. Mountains cover over 60% of the country.
We have to combat iron deficiency anemia at different level everywhere by all means. And what I mean by that we have to fortify flour, to control parasites and helminthes, to control malaria, to combat and control malaria, to improve the obstetric care and reproductive health care.
Hospital is a luxury reserved for the few Yemenis who manage to make it into town. It can take days to travel to the nearest health centre. Once there, patients will still have to pay something towards the cost of their treatment, a cost few of them can afford. 8 out of 10 women are illiterate, and only 1 in 5 receive any medical assistance in childbirth. With little access to family planning, most families have at least 7 children. And women who suffer from iron deficiency anemia are much more likely to die in childbirth. In this hospital in the Yemeni capital Sana'a, 1 out of every 10 women who go into labour die because of complications from anemia.
I feel so sad and frustrated when I see how many women are dying, the cases that we are unable to save. There is a lack of awareness and education about family planning, and also about general health and nutrition issues.
Health education in Yemen till the moment is still limping, and the only issue is preparation, how qualifying people to overcome this problem and to have the suitable training where they can educate the population and the community.
Rachel Chanduru, a health specialist from Uganda, trains midwives in the western region of Yemen. One of the poorest areas, it also has a high malaria incidence, which adds to the problems of iron deficiency anemia.
The problem we have here with the anemia is mostly abortion, stillbirth, and also death of mothers during delivery.
As part of her daily work, Rachel sees the basic challenges that pregnant women and new mothers face. She teaches midwives to discuss primary health care and nutrition with their patients.
And all these midwives here, they do home visits, and she's the one supervising. She says she will be delivering in the house, so I was asking her who is going to help her during the time of delivery. She says she will go to a trained midwife. Salam alaikum.
Rachel accompanies the midwives on their home visits. Eissa is 16. She has 2 children. She gave birth to her second child 2 days ago.
The baby, she delivered the mother here, just in this place where we are. She delivered the mother in the floor here. Sihawa mustamam. Ita kali adi.
Rachel emphasizes the key role midwives can play in persuading women to take iron tablets during pregnancy. In Yemen, ignorance combined with cultural misconceptions often exacerbates basic health problems.
Yes, I was asking her, as a midwife, she was the one taking care of her during antenatal. Did she give her iron tablets? She said yes. That was the first things they told us when we started giving iron tablets. It will make our babies big and we shall have difficulties in delivery, all these kinds of things. But we have to teach them, train them what iron tablets does for the baby and for the mother.
16-year-old Eissa is only a couple of years older than these girls in the same village. Many of them already suffer from iron deficiency anemia.
Children don't have the right foods at the right time, and the mothers need to be taught, in fact, what to feed their children with. Yeah. So most of them are really small for their age.
Tell us what you saw now.
She told me she has 9 children and that's her 10th child. I asked her, why don't you visit the midwife? Because she's nearest to you. She says she doesn't want to visit her. I said, why? Because it is important for you to visit an antenatal clinic, Because if you have anemia or anything, like you have a swollen leg, the midwife would have detected it earlier because this is anemia due to not taking iron tablets and not eating well.
وجب الشكر علينا من تاني وعد الوداع.
Half the population of Yemen is under the age of 15. Many suffer from easily curable childhood diseases. 1 in 11 children die before the age of 5.
Of course, when children have deficiency of nutrition or nutrition deficiency, they will not grow up well, they will not perform well in school, or they will not be active among their peer groups or in the home to help their parents to do some work. The eye, when we look at the eye, it is so pale, and she has this swelling. See this is the medium. Yeah, I think this is a sign of deficiency, and you can see the child is not happy. So this must be one of the signs for deficiency. Here women are not allowed to go outside. And as there's only one market day here, it's the men who go outside to buy food. So it causes anemia to women because market day is only once, and then you have to get food and they don't have storage, good storage. So it's difficult to buy fresh foods maybe which can last for 1 week. They talk about fortification, and I think that could be the best solution here, where there's in fact no food for the community, and they have no access to market, and they are very poor. I think that could be the best thing.
The Red Sea flour mill in Yemen is the 3rd biggest flour mill in the world.
I think that people will accept it because since they know the benefit of this for the health of the people, and especially the mothers and the children, I think they will accept it willingly.
Fortifying flour for bread means people across Yemen, from mountain village to bustling town, can now receive a daily dose of iron as part of their diet. According to World Health Organization studies, it costs just $2 per person per lifetime to tackle the problem of iron deficiency anemia. Flour fortification is one way of ensuring that, with every meal they eat, every piece of bread they consume, people will now get the iron they need to create a nation of physically and mentally healthy people.
Flour fortification is such a great opportunity, and I feel that if you have this bread, people eat bread, they say this is the bread of life, it is life itself, and I think but life should be healthy and life should be prosperous. So if we can add iron and make sure that this bread enhances the iron status of the individual person and therefore improves the economy of the country, I think we have done a great job.
Just yesterday, the Prime Minister of Republic of Yemen and the Minister of Public Health has issued a law to fortify all flours, consumed flours in Yemen. And the challenge now is how to enforce this law.
Bread is a sacred food to the whole Egypt in Egypt. We eat bread in breakfast, we eat bread in lunch, and we eat bread in dinner. I was lucky because I have a mother. She was illiterate. She gave me all foods which I now find that it was very rich in iron and it was very healthy food. Anemia is a very dangerous disease. It affects our health. It affects our future. It affects our children. We have to combat iron deficiency anemia. We have to prevent iron deficiency anemia. We have to be more healthy, not anemic.